In this video, we are going to cover about heart sounds. Heart sounds refer to the noises that occur when blood flows through the heart chambers as valves open and close during the cardiac cycle. So the sound which we are hearing is because of the valves opening and closing. The heart has 4 chambers. They are the right atrium, the right ventricle, the left atrium, and the left ventricle. Valves at the bottom of each atrium empty into the 2 ventricles. There are 2 phases in the cardiac cycle, systole and diastole. You can watch my cardiovascular part 3 video to know more about cardiac cycle. You will get the link in description. The systole is when the ventricles contract and pump blood out, and the diastole is when the ventricles relax and fill the blood. These 2 phases make up the heartbeat. The individual is not usually conscious of his heartbeat, but if the ear or the diaphragm or the stethoscope is placed on the chest wall, a little below the left nipple and slightly near the midline, the heartbeat can be heard. A heartbeat makes a characteristic double thumping sound when heard through a stethoscope because of vibrations of the heart tissues related to the valve closing. The cardiac cycle features 4 sounds. It is much easier to hear the first 2 noises, that is lub and dub, which are high-pitched. The third and fourth sounds are low-pitched and often quieter. Sometimes if the doctor can hear the third and fourth sounds, it may indicate a potential problem with heart function. The most fundamental heart sounds are the first and 2 sounds, usually abbreviated as S1 and S2. 2 sounds separated by a short pause can be clearly distinguished. They are described in words as lub, dub. Now let us see first sound. The first thumping sound, lub, occurs during ventricular contraction when the AV valves close and indicates when ventricular pressure rises above the atrial pressure. These valves close to prevent blood from flowing into either atrium after the 2 ventricles contract to pump blood into the pulmonary artery and aorta. This is the beginning of ventricular systole. The first sound is usually the loudest, longest, and most resonant heart sound. Vibrations from closing the 2 valves known as the mitral and tricuspid valves causes the first lub heart sound. As the valve closes, this creates an audible vibration as the first heart sound. As the valve closes almost simultaneously, it usually creates a single sound. Clinically, this noise corresponds to the pulse and refer to it as S1. S1 is caused by closure of the mitral and tricuspid valves at the beginning of isovolumetric ventricular contraction. S1 is normally slightly split, that is 0.04 second, because mitral valve closure precedes tricuspid valve closure. However, this very short time interval cannot normally be heard with a stethoscope, so only a single sound is perceived. A split S1 occurs when the time difference between the 2 valves increases. Split heart sounds may indicate a problem in the heart. Next we will see second sound. The second sound, dub, occurs when the ventricles relax to receive blood from the atria after pumping blood, which is the diastole phase of the cardiac cycle. The pulmonary and aortic or semilunar valves close, which causes vibrations and results in the second dub sound. This is the beginning of ventricular relaxation or diastole. The sound is shorter and sharper than the first sound. The 2 heart sounds are often described as lub, dub, pause, lub, dub, pause, and so on. If the aortic valve closes before the pulmonic valve, it may cause 2 distinct sounds, which experts may refer to as aortic and pulmonic components. The pulmonic valve may close after the aortic, as the right ventricle can fill with more blood, leading to a slightly longer ejection time. S2 is produced by the closure of the aortic and pulmonic valves at the beginning of iso-volumetric ventricular relaxation, and the sound is physiologically split because aortic valve closure normally precedes pulmonic valve closure. This splitting is not of fixed duration. The timing of S2 splitting changes depending on the phase of respiration, body posture, and certain pathological conditions. The first heart sound is heard as the atrioventricular valve, that is tricuspid and mitral valve close. This sounds like lub of lub-dub. The second heart sound is heard when the semilunar valves close and is loudest at the base of the heart, that is aortic and pulmonic valves. This sounds like dub of lub-dub. S1 split is heard when tricuspid and mitral valves closing asynchronously. S2 split is heard when aortic and pulmonic valves closing asynchronously. Now let us see the third sound. The third heart sound, that is S3, when audible, occurs early in ventricular filling and may represent tensing of the chordae tendineae and the atrioventricular ring, which is the connective tissue supporting the AV valve leaflets. This sound is normal in children, but when heard in adults, it is often associated with the ventricular dilation as occurs in systolic ventricular failure. A third heart sound may be heard if ventricular wall compliance is decreased and structures in the ventricular wall vibrates. This can occur in conditions such as heart failure or valvular regurgitation. Valvular regurgitation is a condition in which one of the heart valve does not close properly, causing blood to flow backward through the valve. The third sound is low-pitched when blood rushes into the relaxed ventricle after the opening of the atrioventricular valve. The rush of blood may be audible. Although the sound is standard in some people, including children and young adults, in others it can signal disease such as congestive heart failure. The third sound may be abnormally audible as a ventricular or protodiastolic gallop, which describes a galloping sound. Now we will see fourth sound. The fourth heart sound may be heard on atrial systole if resistance to ventricular filling is present. The fourth heart sound, when audible, is caused by the vibration of the ventricular wall during atrial contraction. This sound is usually associated with stiff ventricle and therefore is present in patients with ventricular hypertrophy, myocardial ischemia, or in older adults. The fourth heart sound is also low-pitched and very quiet. When present, this sound typically occurs due to the atrium contracting against a stiff ventricle. Some doctors may refer to the fourth sound as an atrial gallop. This sound often suggests the presence of cardiac disease, typically involving a decrease in ventricular compliance and resistance to filling. This may include conditions such as hypertension, aortic stenosis, cardiomyopathy. The four sounds are briefly mentioned in this table. The mitral valve closes just before the tricuspid valve. Also, the aortic semilunar valve usually closes just before the pulmonic valve. Auscultating the four specific regions of the thorax distinguishes each individual valve sound. The 4 points are not directly superficial to the valves because the sounds take various paths to reach the chest wall. However, these points help to define the four corners of a normal heart. By understanding a normal heart's location and size, one can more easily recognize a disease and or an enlarged heart. The 4 points of auscultation used to hear each individual valve sound as are follows. Aortic valve. It is heard in the second intercostal space at the right sternal margin, found right of the sternal border in the second intercostal space, represents S2 sound, that is dub. Pulmonary valve. It is in the second intercostal space at to the left sternal margin found left of the sternal border in the second intercostal space represents S2, that is dub. As we know, aortic valve and pulmonary valve closure is caused S2 sound, that is dub sound. Mitral valve. It is over the heart apex in the fifth intercostal space in line with the middle of the clavicle, found left of the sternal border at the mid-clavicular in the fifth intercostal space, represents S1 sound, that is lub, also the site of point of maximal impulse. Next is tricuspid valve, usually heard in the right sternal margin of the fifth intercostal space, found left of the sternal border in the fourth intercostal space, represents S1 sound, that is lub. So as we know, the mitral valve and tricuspid valve closure causes the S1 sound, that is lub sound. Ear's point, found left of the sternal border in the third intercostal space. The ear's point is a crucial auscultation location for healthcare professionals to listen to the heart sounds and detect any heart murmurs. The base of the heart includes the aortic and pulmonic areas, and S2 will be loudest at the base. Aortic and pulmonic murmurs are heard best at the base, with the patient leaning forward and sitting up with the diaphragm of the stethoscope. The apex of the heart includes the tricuspid and mitral areas, and S1 will be loudest at the apex. S3 and S4, along with mitral stenosis, that is a narrowing of mitral valve, murmurs will be heard best at this position, with the patient lying on their left side with the bell of the stethoscope. Patient positioning for heart auscultation. The patient can be on supine or sitting up. Use the diaphragm and listen at all 5 auscultation sites, noting S1 and S2, and if there are any splits present. In addition, distinguish S1 from S2. Then repeat with the bell of the stethoscope, noting any other extra sound. We have to make the patient lie down on left side. Turn the patient onto their left side and auscultate with the bell of the stethoscope at the apex area and listen for S3, S4 and mitral stenosis murmurs. Listen with the diaphragm at the aortic and pulmonic sides for murmurs when patient sit up, lean forward and ask the patient to exhale. How to distinguish S1 from S2? This is complicated when first starting out with the heart auscultation, but it's vitally important so you can assess extra heart sounds. S1 is louder at the apex. Feel on the carotid artery while listening at the apex. S1 correlates with the carotid pulsation. In EKG monitor, if the patient is on a bedside monitor, the R wave of the QRS complex will correlate with the sound of S1. Basics about S3, S4 and heart murmurs. S3 and S4 are heard best at the apex of the heart with the bell of the stethoscope while the patient is on their left side. It is normal for a patient not to have a S3, S4 or heart murmur. S3 is heard after S2 and sounds like lub dub ta. It is caused by vibrations of ventricle filling from a resistant ventricle due to fluid volume overload or heart failure. S4 is heard before S1 and sounds like ta lub dub. It is caused by ventricular resistance from an atrial kick during presystole, that is hypertrophic left ventricle. Heart murmurs is blowing or swishing noise from blood turbulence in the chambers of the heart due to valve defect or valve problem, that is stenosis or regurgitation. Grading the heart murmurs. Grade 1, hard to hear the sound. Grade 2, it is faint but heard. Grade 3, easily to hear. Grade 4, loud with a chest thrill. Grade 5, it is very loud, can hear when corner of the chest piece is lifted off the chest. Grade 6, It is loudest can hear when whole chest piece lifted off the chest. Causes of this abnormal finding include cardiac hypertrophy, disease, or injury to the ventricular wall. How to test heart sounds? A doctor will listen to the heart using a stethoscope called auscultating. A stethoscope has a chest piece with two attachments called a bell and a diaphragm, which connect via a tube to two earpieces. A doctor can use the diaphragm attachment to hear high-pitched noises such as the first and second heart sounds. They can then use the bell attachment to listen for low-pitched sounds such as third and fourth heart sounds. In some cases, an amplified stethoscope may be necessary to hear the third and fourth sounds. The doctor may listen to different areas of the heart, including the base, between the bottom left of the heart and the sternum, the apex, which is at the bottom left of the heart, the aortic and pulmonary areas to the left and right of the sternum. Aside from the four heart sounds, a doctor may hear abnormal sounds or murmurs which could indicate heart problems. A heart murmur is not one of the four heart sounds. A murmur may sound like a rasping or oozing noise due to a turbulent flow of blood through the heart walls. A heart murmur may be harmless, known as an innocent heart murmur. This type of murmur does not usually cause symptoms, and doctors do not consider them serious. Other heart murmurs could indicate a problem in the heart. These murmurs can result from problems with heart valves such as aortic stenosis and aortic regurgitation. Medical professionals grade murmurs on a scale according to their loudness. They will also categorize the murmur as systolic or diastolic, depending on the stage of the heartbeat. Some heart murmurs may be continuous, meaning a doctor can hear them during both the systole and diastole. The doctor may also perform tests to check a person's heart function with a murmur. These may include an electrocardiogram, an echocardiogram, and a chest X-ray. When a stethoscope is placed on the chest over different regions of the heart, four basic heart sounds can be heard. That is, listening to the heart sound is called cardiac auscultation. The sound waves responsible for heart sounds, including abnormal sounds such as murmurs, are generated by vibrations induced by valve closure, abnormal valve opening, vibrations in the ventricular chambers, tensing of the chordae tendineae, and by turbulent or abnormal blood flow across valves or between cardiac chambers. Murmurs can be divided into two general classifications related to origin: those caused by valve defects and those caused by interchamber defects that permit an abnormal flow of blood between cardiac chambers.